working with community leaders at Project Opioid to try to make progress on the opioid crisis, which has claimed the lives of over 1 million Americans in a decade. Today, we are vigilant that the fight continues, but we have good news to share about progress we believe is historic here in Central Florida around the opioid crisis, giving us hope and direction from where we are now to where we should go from here. And we're going to talk about some next steps. What do we need to do next as a community, as a state, and as a society to continue to save lives during this crisis? I want to take a minute to announce today for the first time that we've seen historic drops in opioid deaths, particularly in Seminole County here in Florida. Central Florida as a whole has seen reductions in deaths that mirror the state numbers and mirror national trends. But in particular in Seminole County, Florida, with the provisional data supplied to Project Opioid, we project a 42% reduction in deaths from 2023 to 2024, which would be one of the greatest one-year reduction in deaths in Florida history. And we think there are some reasons that we need to celebrate. We need to be vigilant again. Every life that's lost is important. We have to keep the fight going, but we're going to talk today about this important moment. I'm going to start by asking Dr. Kendall Cortelyou to come up, talk a little bit about the numbers that we're seeing, and then I'll have Seminole County Sheriff Dennis Lima talk about what they're doing that's unique in Seminole County, and then we will be answering questions. Dr. Kendall?
Thank you. Good morning, everyone. My name is Dr. Kendall Cortelyou, and I'm a professor at the University of Central Florida and the director of the School of Global Health Management and Informatics. So for the last 5 or 6 years, I've been studying the opioid crisis and the number of fatal overdoses that we've seen in our community, across the state of Florida, and across the country. And as Andre mentioned, this is the first time that we've really been able to come to you with some good news, and things are moving in the right direction. So as Andre mentioned, in Seminole County, we are seeing almost a 40% decrease in fatal overdoses between 2023 and 2024. In Orange County, we've still seen significant progress with a 6% decrease in overdoses during that same time period. And it's really important to note that we're using preliminary numbers here because the final numbers haven't been released from the Center for Disease Control. However, we can certainly see a very significant trend that we're seeing in Central Florida as well as the state of Florida and nationally. So there are things that are being done in communities that are really making a significant impact. And we're looking at those and we're evaluating how we can replicate those things that are working in Seminole County, in Orange County, to work in other counties across the state of Florida. I also want to mention that when you hold this true for population, so when you look at the number of overdoses, not just in pure numbers, but also looking at it as a rate of the population, we again have seen a decrease in the overdose numbers, and we see that Seminole and Orange County are a little bit closer in terms of their actual overdose rate when we control for population. So the overall is that this is all really positive, good news. We finally are seeing a turn in the trends. We're seeing a change in the tides in the overdose rate. And so I think now we're going to talk a little bit more about how we've gotten there. Thank you.
When you think about how a community like Seminole County, some of the progress we're seeing in Orange County, how does that happen? Data shows that there's a few things that are working both here in Central Florida, around Florida, and around America. And first of all, we're getting naloxone out in ways we haven't before. This is a generic version of naloxone by a company called Patagus. Their representatives are here today. They made a tremendous donation of this product to Project Opioid this year. But naloxone is being distributed at a very high level in Seminole County. It's getting its way all across this state, and we're seeing it work. I was talking to the staff, Sheriff Dennis Lima's staff before the event. In 2024, they're reporting roughly 62 to 66 deaths, which is a historic low. But they deployed naloxone, just their officers, 99 times to revive someone and save their life. their death rate could have potentially been double what it was, but naloxone is out in the community and it's working. So communities that are distributing naloxone are seeing results. We're also seeing law enforcement as a deterrent for maybe the first time in this crisis. We have talked to those who are unfortunately struggling with drugs and who are still actively buying drugs on the street, and they will tell you that drug dealers are scared. Drug dealers are nervous because if they deal a fatal dose of fentanyl to someone who doesn't know that drug is there, or maybe they bought that drug illicitly, that person's going to pay a penalty, and a stiff penalty at that. As Sheriff Lima talks about often, we need to have compassion and grace for those struggling with drugs. But if you deal drugs and someone dies, you need to experience penalties that absolutely detour you. Seminole County's doing that, and I think we're seeing success because of that as well. Enforcement matters. And then leadership matters as well. I think there's all kinds of questions right now beyond just the opioid crisis. How are we going to tackle mental health in this country that's driving the opioid crisis? How are we working on issues like homelessness that overlay with the opioid crisis? The public sector, counties in particular, must continue to strive to use public sector money to make this crisis a success and to save lives. I think you've seen Seminole County with the leadership of Dennis Lima and the county there and all of their partners. They're doing something unique, but we have to continue to say, we've got all this money from the settlements, how are we using it? And I think in Seminole County you're seeing success there as well. Where do we go from here? Big discussions again on Gen Z millennials struggling like they never have before. The mental health crisis driving addiction in this country, in this society. We have to look at that. And we have to look at changing the conversation and the stigma around those that reach out for help. There are medications that people can take who are struggling with drugs. Often these medications are not available, or if they are available, people have a stigma around taking them. We need to continue to educate those who are struggling that help is available and that we care about them. I'm going to ask Sheriff Dennis Lima to come up and talk a little bit about what they're doing in Seminole County and just hear his thoughts on this historic day where, again, 1 year, 2023 to 2024, a 42% projected reduction in deaths in Seminole County. Sheriff?
Thank you. First and foremost, I want to thank Andre for your leadership, your advocacy, pulling together the leaders of Project Opioid, which is unprecedented. You know, we each have connections and relationships in our own space, but it's not until you pull people from various spaces together, from the faith community, from the government community, from the business community, to really work together in harmony on a particular challenging issue that our country, our community faces. And I want to thank you for your team of pulling us together and the ability to do that. Significant decreases, right? We've got nearly a 30% decrease in overdoses or fentanyl poisonings, as sometimes we call them now, and a more than 40% reduction in the deaths associated with that. We're incredibly proud of the reductions, but the numbers, the volume of numbers is still incredibly alarming across the state and across the country. In volumes, you heard a little bit about, nearly 100 deployments of an opioid antagonist by our deputy sheriffs alone. We had 427 overdoses in Seminole County, a very affluent county, great resources, great government. We had 66 marked deaths, and again, that's a 42% decrease from the previous year. So I don't want people to hear about the reductions and just take a victory lap and think that our work is done. Actually, the hard work still lies ahead of us. But what we've seen here in Central Florida, and we've seen, quite frankly, across the state of Florida, is a shifting paradigm when it comes to substance use disorder, which was once upon a time something that people were embarrassed to share. which was believed to be people who were living under the overpass somewhere with a whole history of substance use and ultimately going down that path. We realized that this simply is not the case, at least in the beginning for 80% of the people. They were introduced legally by following the doctor's orders. That led to an unprecedented focus on closing those pill mills and those rogue doctors. That no longer is a problem in this country any longer. Andre talks about it a lot. We don't have a problem with overprescribing. Everyone knows of the dangers of opioids. People then turn to synthetics. And the drug cartels, the two major drug cartels, are never going to move away from that. So the strategy, what works? The model of Project Opioid coming together absolutely works. All of those things that typically divide us, our faith, our politics, where we like to have lunch, that was all set aside for groups of people from all walks of life to come together and work on this as a collective strategy. We partner with Advent Health. Advent Health deserves an incredible amount of credit here because it was 4 or 5 years ago, I was sitting at a luncheon on the heels of COVID, and we were vacating a building, and I leaned over to the CEO at the time, Tim Cook, and said, we have a vacant building in a uniquely positioned space directly across from our correctional facility. I'm thinking about creating a substance use program where people can come in and get help, regardless of their ability to pay. Uninsured, underinsured people, would you be willing to partner with us and do something with that? I mean, it wasn't a day before Tim came back and said, we'll do it, we're in. We'll figure out everything else as we move forward. And that center quite literally is saving lives. People are being diverted to that center. Family members are dropping off loved ones there, and they're being cared for with the gold standard of treatment, medical-based treatment, combined with cognitive behavioral therapy, MAT, and we've got our partners, Mark and Todd, and they're doing such great work with getting people medicine. We said in the early stages of this is not a situation in most cases trying to make bad people good, but rather sick people well. And we need to treat individuals who are addicted and dependent on a substance with compassion, love, and then the resources necessary to find sobriety. I want to give credit to our governor, Governor DeSantis, First Lady Casey DeSantis, Attorney General Ashley Moody. From the moment that they took office, they were so incredibly passionate about the work that we're doing in this space and have been incredibly helpful both with the resources financially and support globally on the strategy that we've implemented. Right now, I'm on behalf of Attorney General Ashley Moody. I'm chairing the statewide opioid abatement council, which deals with the settlement money. And the only reason I'm doing that on her behalf is because we have a strategy that we feel is collaborative. And I think that the numbers show that it actually works. This model has really brought in a lot of attention, a lot of focus. Our Board of County Commissioners play an incredible role with the services that we provide. They have to lean and support because for qualifying counties, and all of the counties throughout the Central Florida area are large enough that they are qualifying counties where they're receiving some of that $3 billion opioid settlement money over the next 18 years. And they say, let's move forward with the best practice standards, and let's try to implement whatever we can. And they've been incredibly supportive and embracive and passionate about this topic. And last and certainly not least, in the strategy, I think enforcement has to be discussed. And when I talk about enforcement, I'm not talking about the person who is dependent and addicted themselves, charging them, throwing the book at them, putting them behind bars. Some of those individuals need to go to jail. But I think that we make the argument that jail sometimes is not the best place for somebody who's addicted to a substance, especially if they were legally prescribed at one time to create the dependency and addiction. But the drug dealers, the people who are 2 or 3 level removed from the cartel, the people who are dealing death on the streets every single day, the people who have no care for human life whatsoever, most of them are not even using the substances that they're dealing themselves, and they are unknowingly tainting other substances, marketing it as heroin and marijuana and other types of things. lacing it with fentanyl because of the addictive properties of fentanyl. Right? They do it because of the addictive properties, meaning that if somebody is addicted, they're going to come back and buy from the dealer again. So in many jurisdictions across this country, drug dealers are literally getting away with murder. And because of our work with our Florida legislative delegation, more specifically our Seminole County delegation, State Representative Rachel Plakin and State Senator Jason Broder have lobbied year after year bills that we have brought to the forefront that helps us tighten up the laws surrounding drug dealers and dealing in drugs and scheduling of drugs to the point that I'm still knowledgeable of the numbers. Seminole County leads in the prosecution of first-degree murder cases in the state of Florida when we're charging successfully drug dealers for dealing deadly doses of drugs on the streets. Because, as Andre said, the increase of opioid antagonists are not only policing agencies and EMS personnel, but private citizens are now actually unprecedentedly deploying naloxone. We knew that the most important thing was to save somebody's life, and this is saving people's lives. The second thing is when you save somebody's life with using an opioid antagonist, you are also protecting the drug dealer. They were literally getting away with murder. So other than the family and the individual that you saved, the second party that was most happy about the deployment of naloxone was the drug dealer, because the drug dealer was not being formally charged as somebody was being revived. That has changed in the state of Florida based upon on our advocacy. Those leaders that I talked to you about with the Florida delegation, the legislative body, we now have the ability to charge a drug dealer with second-degree felony culpable negligence when we can prove that they dealt drugs and we revived the patient, the victim, with the use of an opioid antagonist. And that was pretty significant. And then what we're looking at now, our legislative priorities this year is xylazine. We know the presence of xylazine is now increasing. It has been found mixed in other substances across every single state in this country. Xylazine has a legitimate use, mostly in veterinary work and equipment and working with animals, but people are actually using it and injecting it because of those same properties. And not only does it create this environment that is incredibly dangerous because it's non-responsive to opioid antagonists, or Narcan does not work with xylazine. There is no federal scheduling of xylazine. It is scheduled here in the state of Florida, but it's not scheduled nationally. And there's no minimum mandatories right now in the state of Florida. So what we're doing is now we're lobbying the legislative body to make sure that the minimum mandatories and the same penalties for trafficking xylazine match the penalties for trafficking fentanyl and other substances. If we don't do that, it would actually push the drug dealer into using xylazine, which we know is incredibly deadly because of its non-responsive properties. Lastly on that, it eats the flesh away. It creates ulcers, and when somebody injects the point of entry, it kills the flesh around that area. So because of the immune system is diminished, the wounds on the body does not heal. And we've had people incarcerated with incredibly graphic, but no skin on their arms whatsoever, as they've been intentionally or unintentionally using xylazine. As I close here, we are incredibly pleased with these numbers. We're incredibly pleased with the partnership with Project Opioid. We have embraced Project Opioid from the beginning and used the fundamental cornerstones of this philosophy to implement properly in Seminole County. But the hard work lies ahead of us. We have a crisis with mental health that's directly tied to this. And when you look at the neonatal effects right now, is something that we're digging into more closely, and we'll do a lot more work over the next year, is when you saw this peak in people being overprescribed, and then this peak with people entering a medical-based treatment therapy, whether it's buprenorphine or methadone. Sometimes those people are pregnant people, And sometimes those people are just simply trying to work on their recovery. And MAT works incredibly well for the patient, but as children are being born with this, we're going to see a lot more people that are raised and have unintended consequences that are later down the road. So you'll see us digging in more with mental health and the neonatal concerns of really innocent victims that are born with some level of support. Not one person, not one organization, not one entity can take credit for these numbers. We hope to keep presenting these positive results. So I know I went long, but we have a lot to talk about.
I have a question for the chair.
Yep.
It seems like the bottom line so far this morning was cooperation from entities that don't normally cooperate, talk, anything like that. How do you keep that going?
I think that there has to go with in order for a strategy to work, there has to be a huge level of humility. And you have to know what you're good at and what you're not good at. When I come up here and I talk, I'm standing in a uniform and I have a title behind my name that recognizes authority. We describe this profession as law enforcement. I make the argument that what we do is policing, and policing extends well beyond enforcement. But I think that the stereotype of a lot of people wearing the uniform is just enforcement, take bad guys to jail, and it's everyone else's responsibility to figure out what went wrong, to address recidivism. I don't believe that. I believe that it's in the best interest of our citizens to come together. But I look at Andre. I can't do what Andre does. Andre can make a phone call and pull leaders from the business community, faith community, all in a room together. I have to partner with somebody like Andre. I've got to partner with somebody like Mark, who knows the medical aspect of it. I can learn from them and use the talking points. And in layman's terms, I gave the example of this one time. It's almost as if you saw somebody go unconscious in this news conference right now. We would all render aid to the best of our ability. Somebody is going to be more qualified than others that are in here. And we're going to start CPR. We're going to call EMS, and EMS is going to have more qualified people than usually are here. Not in this environment, but usually. And then you're going to get to the hospital, and there's going to be more qualified people at the hospital than are in the back of the emergency vehicle. The problem is the people who start CPR never stop giving CPR. There is no handoff. There's more interest in getting credit for a strategy. So the person that starts an initiative never runs its course and says, I now have to hand this off to somebody that's more qualified and more resourceful than I am. We created a strategy in Seminole County. I knew that we could not do the medical aspect of it, so we asked Advent Health to do it. We knew that our strategy was unique to Seminole County, and we knew that we could not spread that, so we had to hand that off to Andre and say, here's the partnership we have. If you find a need as you go around the state of Florida and now other states in our nation and could benefit from what we've done, please do me a favor. Don't ever mention the Seminole County Sheriff's Office. Take our playbook, take our policies. If you're watching this broadcast back, if you're sharing it on some social media feed, contact us. Take our name off and put your name on it and use it. The numbers showing that it actually works, and we're incredibly proud of that.
Sure. Let me add that it's one thing to talk about collaboration and people coming together. It's another thing to ask the key question, which is, who is accountable? When you have a historic amount of deaths, opioid deaths being the #1 cause of death, especially during the pandemic for those 40 and under, who is accountable? And I think one of the things that Sheriff has helped lead is a collaboration that leads to asking questions of those that have money, resources, run our systems of care, government leaders. Who is accountable when there is a historic amount of deaths? And do we have the ability as leaders to look at each other and ask, can we not do better than this? And I think that's really what Project Opioid has, with Sheriff's help and with everyone's help in this room, brought about, which is we cannot allow a Central Florida where our young people are dying at historic rates the way we saw it during the pandemic. When we came together in the spring of 2019, we announced that we would not stop this work until we saw the death rate cut in half That was the goal. And we saw that death rate not only not go down during the pandemic, but we saw it almost go up by 50%. With the work you're seeing in Seminole County, Sheriff Lima leads the state task force. What a privilege to have the governors, the First Lady, Ashley Moody, the Attorney General's key person in Central Florida. But we believe that in the next 18 months, in Central Florida, we can finally see a full 50% reduction in deaths, not just in Seminole County, but in Orange and Osceola and all the surrounding areas. And that must be our goal, because every time we don't meet that goal, we get another phone call. I don't know about you, Sheriff. I don't know about you, Lisa, Tim, who runs amazing work in Bithlo around medication-assisted treatment. I don't know about you guys, but I get really sick and tired of answering my phone at 11 o'clock at night or 2 a.m. When you get a call that late, you almost always know it's something tragic and terrible. And it's the same call over and over again. It's a parent, it's a husband, it's a wife calling to say, my loved one lost the fight. And the repetition of death and carnage we've seen from the opioid crisis and from fentanyl being pumped into our society has been unlike any tragedy we've seen in modern history. But today, I think we see light at the end of the tunnel, and I think we see a playbook in Seminole County and in Central Florida as a whole that our state and that maybe other states can learn from, and we couldn't be more excited about that. We're going to take more questions, but I also want to announce that on April the 8th, we're going to be partnering with the Orlando Magic, Florida Blue, and Sheriff Lima and others to launch our 3-year strategy for the community and make some statewide recommendations. Where do we go from here? We will not stop until the death rate is cut in Central Florida and in this state by 50% from where it was at the height of the pandemic in 2021. How do we get more naloxone out? Now, law enforcement carrying it almost everywhere, but how do we get it into our universities? How do we get it into bars and clubs and places where young people might be overdosing? How do we expand medication-assisted treatment, especially to vulnerable communities like you see in Bithlo, where the death rate and the overdose rate sometimes is 5 to 10 times where it is in other parts of the community in the state? And how do we change and educate our young people when they're struggling with mental health? The shocking thing is when you talk to our college-age kids, our 20-somethings, even our teens, and they're taking drugs, they know there's fentanyl in it. They know they're risking their life, but sometimes because of mental health issues, they choose a drug that could kill them to numb the pain, both physically, mentally, emotionally, and spiritually. How do we help address that? So April the 8th, we're excited to be looking towards what is the future of this crisis and how do we make more of a difference. Questions?
I have a couple of questions. One for Sheriff Lima and then another for anyone who can answer. First of all, I know the Orange County Jail, for instance, has a medication-assisted treatment program in the jail system. Does Seminole County have that?
Yeah, so the question is, what we do on the inside. And we're actually one of the first correctional facilities, first counties in the country to offer 3 forms of medical-based treatment therapy on the inside of our facility to our incarcerated population. We felt like that was a medical decision between a medical practitioner and a patient. So methadone, buprenorphine, or Vivitrol were those 3 options, combined with cognitive therapy. And then we then isolated people who were on this journey into various programs that are run 24 hours during their incarceration process. Those programs have been so successful that the first time in my 32-year history, we had participants in the program incarcerated petitioning their judges to extend their sentences because for the first time in many, many years, they were getting clean and moving right in the right direction. And then lastly, the relationship with Advent Health and the proximity of their newest location, Hope and Healing, directly across from our correctional facility. There is a warm handoff, as we like to say. Most warm handoffs are actually incredibly cold when you dig down into the details of them. But this warm handoff, absent any financial resources, occurs through that relationship and process. And for a good number of years, we had an executive of Advent Health actually embedded within our correctional facility, our healthcare department, looking that over. So that's one of the programs that we're incredibly proud of, male and females in our facility, and that has been toured by chief executives from the DEA, from people from across the country to come and look at those programs.
Sure. Let me piggyback off your question and answer it a little bit of a different way. I think we should applaud the reduction in deaths in Seminole County, but at the same time, I think we should look at these numbers. The question is really, now that we know how to reduce deaths, now that we know how to reduce overdoses, for counties, for law enforcement, for public sector officials whose communities are not reducing their deaths by this number, then you have the answer to your question right there. If in communities where the death rate might be slightly down or stable at the trends we saw during the pandemic, they are not carrying naloxone the way they need to. Maybe they say they have an MAT program in the jails, and let me tell you, there's a difference between treating 10 people and making it available to everyone who asks for it. We have historic amounts of money in every county in this state that come from Big Pharma, who were sued, who were responsible. How is that money being used? I think the questions answer themselves now, because when you see a community like Seminole County cut the death rate by 42% in 1 year, and by the way, they're going to go back today and they're going to say, all right, this isn't enough. We got to do more. We can get this death rate down by 70%. The communities that are not seeing historic drops in their deaths, big, hard questions need to be asked about how they're spending public sector money and if they're taking accountability. If you are not expanding your programs, you should be held accountable as a public sector official in every county in this state and every community in this country. And so the questions answer themselves. And by the way, it's not whether or not you offer a program. Every community will say they offer a program. If someone calls you today and their family member's in need, and they call the hotline, they call the number on the billboard for help, what really happens to them? Do they really get navigated to help? Or is it lip service, and do ultimately they end up at the end of waiting lists where they never get help? It's very easy to know. Look at the death rate in your community. Communities now that are not seeing drops in deaths should be held accountable by their citizens that they need to do more. Seminole County should be applauded, and everyone else needs to look at what they're doing and ask tough questions, because it's not a percentage, it's deaths. It's kids who are dying when we don't do what we know what to do. I'd go back 5 years and say we didn't know what to do. We didn't know naloxone worked. We didn't know medication-assisted treatment, whether it worked or not. These things were all controversial. Any community not distributing naloxone, not giving medications for people struggling with drugs, any community that doesn't have a clear path for a young person when they're struggling, and not using the billions of dollars that their counties and all of their leaders have been given, should be asked tough questions. And the death rate tells you the truth. Nothing is true but whether or not the deaths are reduced in your communities. And we have every community in the state of Florida. Why are some communities' numbers shockingly down, like Seminole County's, and others are stabilized or up? These are very, very fair questions, and the answer is, what are we doing to help these young people?
Yeah, so that was actually my other question was...
See, I could read your mind. I knew you were going, so.
I've been following the spending of Orange County specifically in terms of the opioid settlement funds, but I'm not as familiar with the specific initiatives that have been earmarked, so to speak, in So I was curious if you could speak a little bit more on what exactly those funds are being used for there, and also how publicly accessible is this information? Like, is there any sort of database on the county websites where people can see specifically what the public sector is spending these funds on?
So on April the 8th, Project Opioid will be releasing an analysis of, from the best of our ability, how we think the counties are doing, how we think the state is doing with these funds. But by the way, I just couldn't agree more that, you know, we have to hold the line, and we have to hold ourselves accountable in ways that maybe we've not been able to in the past. Why are the deaths dropping in Seminole County? Not because this guy carries a gun, but because he carries respect in the office of the sheriff. He walks into the Seminole County Board of Commissioners, who are great people, and says, we got to do more. We've got to save lives. We've got to be accountable with the money that we're getting from the state and from the federal government, and you're seeing the result. We don't have that exact information. As a community, though, we are going to be reporting on that, and I think Seminole County has laid down the gauntlet on what should be done. They're just at the beginning of what should be done around the opioid crisis. And it's time for us to, with as much respect and as much professionalism possible, hold our public sector leaders accountable. If you receive money from the opioid settlements, or you receive state or federal money, how is that money being spent? And if it's not being spent in a way that sees historic reductions, you've got to ask yourself, what do we need to do differently? That might sound tough, but it's where we are at, and every day we are not accountable to each other. Young people continue to die. I don't know if that was what you were looking for, but by the way, if you wonder why my energy changes around that, answer your phone every single day and explain to a parent why their kid wasn't offered help, and that their funeral's in 5 days, and they were never told that there was medication-assisted treatment, not necessarily in any particular community, but we know what to do to solve this crisis. Now, we must celebrate today a historic reduction in Seminole County and hold ourselves responsible like never before to do what we know works and save lives in a way we haven't before. And that's what we hope to continue to see.
Question for the sheriff: how do your deputies feel? You know, almost 100 deployments of opioid antagonists, knowing that they're saving lives. How are they feeling?
Yeah, so, you know, we talked a lot about the partnerships and the strategies, and quite frankly, none of this is possible without the men and women that are passionate about this topic. I will tell you, when we first started going down the path, there was a little bit of like, what are we really doing now? Is this our job? You know, when I started in this business, we did not carry medicine on our belts that brought people back to life. And I've been introduced to different concepts and theories along this journey, like compassion fatigue. And when somebody said to me, compassion fatigue, I said, is that a real thing? And they said, it's absolutely a real thing. To see death and to be able to reverse the effects of death is something that is incredibly touching and special. And what was met with you know, a kind of a questioning eye in the beginning has now become their passion. We attract people from across the country that want to become members of the Seminole County Sheriff's Office, and when they sit for their interview, some of the first thing that they talk about is our strategies and our partnerships. And there's a lot of things that we can do as citizens to make us feel good. Maybe it's helping a family in need, maybe it's you know, giving to some charitable cause. But I'm telling you, nothing makes you feel better to see death in the eye and reverse the effects. It's as close to having a magic wand as possible. And I am so proud of our team, because none of this would be possible without them. They're the ones that respond to that call at 3 o'clock in the morning or 11 o'clock at night. They're the ones that work with those families, not just during their moment of crisis, but for months and months. In many cases, become lifelong connected to these families. They are so happy and so blessed, and I'm so proud of them.
Any other questions?
I have a question.
Yes, ma'am.
Welcome and congratulations, Sheriff and Andre and the team, on the work that you're doing. As you know, I represent two organizations. Those of you that don't know me, I'm Cheryl Brown Merriweather, and I'm the co-chair of the Florida Recovery Friendly Workplace Initiative, a statewide coalition of organizations and individuals around the state working to support recovery support services. And I'm also a past president of Go SHRM, the Greater Orlando Society for Human Resource Management, as is Pamela McGee, our immediate past president. What can we do to support you more with respect to the workplace and the workforce? Go SHRM, for example, is the largest chapter in the state of Florida. We have 600 or 700 work with mental health and substance use disorder over the past 2 or 3 years, and we want to do more to support you. So I know you have many things that you planned and are thinking about, but for the benefit of the community, are you able to speak on those things and what the workplace and the workforce can do to support your initiatives to continue the great success that you've enjoyed so far?
It's an excellent question. We believe that the workplace is the new front line when it comes to the opioid crisis, meaning if someone is struggling with drugs, if they have a family member struggling with opioids, the first call is going to be often to an HR department, to someone who ensures that they get access to medical care. So our programs need to continue to expand. We're going to be looking to expand our programs in 2024 around helping the workplace, HR directors, EAP programs have more available. Often an employee will feel nervous to reach out to their employer when they're struggling with drugs, when they're struggling with addiction in general. That stigma is something that can be changed. Kim Lopdrop, board member of Project Opioid, former CEO of Red Lobster, he saw tremendous impacts by turning the culture, the connection, and the conversation towards addiction recovery at Red Lobster. We want to see more and more companies. On April the 8th, we'll have over 200 Central Florida businesses in attendance. They are very important. And they also, listen, when you're wanting to create a community strategy, government by itself will struggle to solve any issue like this without the help of the private sector and the business community and the faith community. Government struggles when the business and faith communities do not partner with it to solve an issue, and I think that's one of the secrets of the success of Seminole County and where we've made progress in Central Florida as well.
So in April, we can expect a presentation of this playbook to all of those businesses.
Where do we go from here? Where do we go from here to have deaths reduced across Central Florida by 50%? What's the next phase of this work inside of our corporate community? And as we were asked today, billions of dollars being spent, money coming from big pharma, from the lawsuits, so much opportunity, a playbook that's so clear. Expand naloxone, make sure people get help in the jails, make sure if they leave a hospital and they've overdosed that they have clear treatment. If they call a hotline, do they get help and is someone there, or are they simply left on a list to not get help? Holding each other accountable with money, who's in charge, who has the money, and who is accountable. We continue to answer those questions. We will be the most successful community in Florida, maybe around America, at reducing deaths. One death is too many, but finally seeing progress around the opioid crisis and the fentanyl deaths. It's something that we should applaud. Seminole County Sheriff Dennis Lehman, his team, Advent Health, others deserve all the credit in the world. But now where do we go from here? Any other questions?
I have an off-topic question for the sheriff, if that's okay.
Yeah.
We'll see. If he doesn't answer, you'll
Just send it. So if you're familiar with the governor's announcement to have a special session to make a law that requires local law enforcement to cooperate with enforcement on immigration laws, and if Seminole County work with ICE on these cases, what kind of resources from the sheriff's office are used to make that happen?
Yeah. I haven't seen the news conference, but we've always partnered with our federal partners, ICE being one of them. You know, we are one of the local correctional facilities that actually has a state contract with the U.S. Marshals. So our facility is a little bit unique because we're housing of federal inmates, immigration officers, as well as FBI, DEA, U.S. Marshals are frequently in our offices and around. And look, we're going to support whatever the legislature decides. I mean, I raise my hand and take an oath to uphold the Constitution and government of the United States and the state of Florida, and that's what we're going to do. But I haven't seen the news conference yet, but we always partner with our federal partners and do everything that we can.
Thanks, everyone. Round of applause for Seminole County.
So we can look at, because there are great things that come I love it. I love it.